Good morning, Mr. Hive. My name is Julia, and I'll be your nurse this morning. Can you tell me what brought you in?
I think I have a fever, I have a headache, my muscles ache, and I've been waking up with chills and night sweats. I also have a sore throat, and I noticed these weird rashes on my chest.
So can you tell me when your symptoms began?
It really sucks. It's been about 2 weeks, and it feels like the worst flu ever. I feel like dying.
Have you taken anything to decrease the symptoms?
I've been popping a bunch of Tylenol, and it doesn't work. I don't know what to do anymore. Ah!
Okay, Mr. Hive, well, we're just gonna go ahead and run some lab work, and then we'll have a doctor in shortly.
Calm down, honey. Everything will be okay. Just relax.
Dr. Bosses, I have a patient in room 104. He reported that he has been having a fever, chills, night sweats, and a rash on his chest. He's been having these symptoms for over 2 weeks. I took his vital signs. He has a high temperature of 100.5 degrees Fahrenheit. He is breathing rapidly. His pulse is 102. His oxygen saturation is 94%, and his blood pressure is 130/50.
Thanks, Julia. I'll check up on the patient right now. Hi, Mr. Hive. I'm Dr. Bosses. Based on your test results, unfortunately, we found that you're HIV positive.
What? What does this mean?
So basically, your immune system has cells to protect you from getting sick by fighting off viruses that get inside your body. However, these cells are being attacked by HIV and turning them into viruses like them. So there will be too many of these viruses that your immune system cannot handle and fight off, making your immune system weak and suppressed. You will have a higher risk of getting infected easily from other viruses and other sorts of diseases. Also, HIV is contagious and can be transmitted through bodily fluid like urine, feces, saliva, tears, and especially through blood and semen. It's best to try and prevent the spreading of the HIV infection to others, especially since HIV is more easily transmitted from an infected male to an infected female. Always practice safer sex by wearing a condom and avoiding anal intercourse. I suggest that your partner will also be tested as well. I'm prescribing multiple drugs for you to use that will fight against the virus in 3 different ways. We call this treatment HAART, which stands for Highly Active Antiretroviral Therapy. Our goal with this treatment is to stop the virus from replicating so that your immune system will have the chance to fight the viruses off. Your body will need to get enough nutrients so that your immune system will work better. You will be getting a total parenteral nutrition solution that will contain everything of what your body needs, like electrolytes, water, glucose, protein, and vitamins to stay healthy. A nurse will come in and give you your total parenteral nutrition. Do you have any questions?
No, not right now. Thank you.
HIV targets and destroys CD4, also known as T4 cells. The hallmark for this disease is to suppress immune system, leaving a person wide open to contacting an opportunistic infection. HIV literally hijacks T4 cells. Once inside the cell, it forces cells to copy itself and then go and infect other cells. The virus contains proteins on its outer surface that will try to dock onto receptors of the T4 cells. The virus carries along with it an enzyme called reverse transcriptase, also known as RT. RT makes it possible for the genetic material in the virus to convert to the genetic material on the T4 cell. The enzyme integrase allows the virus's newly converted DNA to worm its way into the T4 cell's nucleus. The enzyme protease clips the new genetic material into lots of pieces. All the new pieces gather within the infected cell. Finally, you have a T4 cell that is not itself anymore, but a virus. Initially, the patient's immune system will destroy the infected 4 T cells, but eventually, there are just too many viral cells and not enough uninfected 4 T cells. The first challenge is for the HIV particle to get inside the host cell. HIV accomplishes this task by first finding a way into the host's bloodstream. Once in the blood, HIV hijacks certain cells. If HIV successfully enters CD4 plus T cell, it can then create more viral particles. When a person is infected with HIV, the virus randomly pumps into many cells. The docking proteins on the outside of the virus try to find special receptors on a host cell that will allow the virus to bind and then enter the cell.
Hello, Mr. Hive. My name is Elizabeth, and I will be the nurse inserting your PICC line. Before we begin, I'm going to give you this consent form to sign that states you understand all the benefits and risks of the procedure. Do you have any further questions?
PICC? What?
A peripheral inserted central catheter is a thin, soft tube that we will use to give you total parenteral nutrition, which is a combination of carbohydrates, proteins, fats, vitamins, minerals, and trace elements to improve your nutritional status. The PICC will be inserted through the peripheral vein and advance until the tip of the catheter reaches the superior vena cava, which is a large vein above the heart. Afterwards, we will do the chest X-ray to make sure that the PICC is in the right place before we begin TPN infusion. Hello, Mr. Hive. My name is Dr. Jackson, and I'm the pharmacist, and I have a multiple drug regimen that I'm going to prescribe to you. This regimen is called HART, a highly active antiretroviral therapy.
Okay.
The goal of this regimen is to stop the virus from replicating so the immune system will have a chance to do its work. This pharmaceutical therapy will hit the virus in 3 different ways with 3 different drugs.
Oh, well, that sounds great.
The first medication you'll be taking is Retrovir. It is a nucleoside reverse transcriptase inhibitor which prevents viral replication. The second medication is Virimune. This is a non-nucleoside reverse transcriptase inhibitor. It disrupts DNA synthesis. It slows the progression of HIV infection and decreases the occurrence of the sequence. The last medication is Crixivan. It is a protease inhibitor and prevents cleavage of viral polyproteins. This also slows the progression of HIV infection.
Oh, wow, that sounds like a lot of medications.
There are 3 medications, and it's very important for you to take your medications and don't skip or miss any doses. Missing a dose can promote drug resistance, making them ineffective. You can also be sure to report any symptoms to your physician so other medications can be prescribed. For example, Flagyl can be prescribed if you are experiencing diarrhea, or Diflucan if you're having a fungal infection. So, Mr. Hive, be sure to follow the drug regimen. Do you have any questions? All of the paper instructions will be given to you before you leave the hospital.
Oh, no, I don't have any questions right now, but if I do, I'll be sure to call you.
Oh, okay, Mr. Hive, that sounds like a great idea. I look forward to hearing from you.
For care for a patient with HIV, place the patient in a private room whenever possible. Use good hand-washing techniques or use alcohol-based hand rubs before touching the patient or any of his or her belongings. Ensure that the patient's room and bathroom are cleaned at least once a day. Monitor vital signs every 4 hours, including temperature. Inspect the patient's mouth at least every 8 hours. Change wound dressing daily. Change IV tubing daily. Keep frequently used equipment in the room for use with this patient only, including blood pressure cuff, stethoscope, thermometer. The patient to eat a low bacteria diet, for example, avoiding raw fruit and vegetables, undercooked meat, eggs, and fish. Pepper and paprika as seasoned sprinkled on food right before eating. Not to share personal toilet articles such as toothbrush, toothpaste, washcloths, or deodorant sticks with others. It is important to teach the patient to wash hands thoroughly with antimicrobial soap before you eat or drink, after touching a pet, after shaking hands with anyone, as soon as you get home from any outing, and after using toilet. Also to clean toothbrush daily by either running it through the dishwasher or rinsing it in liquid laundry bleach. Teach patients not to drink water, milk, juice, or other cold liquids that have been standing for longer than an hour. Report temperature greater than 100 degrees Fahrenheit. Report persistent cough. Report pus or foul-smelling drainage from any open skin area or normal body opening. Also, report urine that is cloudy or foul-smelling or that causes burning on urination. Advise patients not to dig in the garden or work with household plants. Also, to wear a condom if you're a man when having sex. If you're a woman, Having sex with a male partner, ensure that he wears a condom.
She was more like a beauty queen from a movie scene. I said, don't mind, but what do you mean? I am the one who really changed my love. She just a girl, but I am the one. Oh, no, but the chance, not my son.